And taking a look at the recent COVID-19 numbers, just over 2,700 additional COVID-19 cases were added today. Our active cases, hospitalizations, and number of Arkansans on ventilators all increased over the last 24 hours. 17 more deaths were also added to the total. And the city of Little Rock is once again under a mask mandate. Mayor Frank Scott Jr. announced the requirements this afternoon, and this all goes against state law. Katrin Asaf was at today's announcement. Katrin, we need clarification on what this means for people who live in Little Rock.
Well, Donna, Kevin, right now what it means is if you're heading into a public indoor space such as something owned by the city or a community center, you're expected to wear that mask. While the mandate technically covers everything city-owned, including things like parking lots and sidewalks, it's practically meant to be enforced in indoor public spaces such as City Hall behind me if you're going to be entering those doors anytime soon. Now, technically, by doing this, the city is going against state law. Arkansas legislators banned further mask mandates at the state and local levels this spring. The city mandate comes as the Arkansas legislature meets to consider exempting certain public schools from the ban. You just heard that both of those measures have failed, but local entities are not being considered just yet. Scott Jr. says he understands the hesitancy to mask up again, but we all need to act to keep each other safe.
It is a very uncomfortable thing, but right now we have to be uncomfortable to protect the public safety, health, and welfare of the residents of Little Rock.
Now, the mask mandate comes as part of the city's emergency declaration, which is set to end at the end of August. Leaders will then take another look at the COVID situation and go from there. Coming up tonight, we're going to have more on exactly what this mandate entails, what the legal implications of it are, and how people are reacting. Reporting in front of City Hall, I'm Katrin Asaf. Back to you.
All right, Katrin, thank you very much. As active cases continue to climb, so do hospitalizations. Looking at the most recent data, out of the 8,800 beds available statewide, just over 1,200 are currently filled. In terms of ICU beds, a much different story. Of the 1,100 in the state, only 36 are available at this time. As a result, hospital officials are deeply concerned. In fact, some are now being forced to use other areas just to treat critical patients. Our Claire Kreitz joins us live from UAMS after getting an inside look at the conditions there. Claire.
Yeah, Kevin, here at UAMS, resources are stretched thin. I talked to an ICU nurse who says it won't be long until they'll have to turn patients away. Doors are shut, rooms are full here at an ICU unit at UAMS, forcing these healthcare workers to create space for patients.
We've actually taken over up to 12 beds on a neighboring unit just to care for our additional patients.
Elizabeth Sullivan is the clinical services manager for one of the ICU units. She says right now almost 30 of the rooms are patients with COVID-19.
Which is more than we had at the first surge.
This running down their resources and running down their employees.
They're tired. People are leaving the bedside. They don't want to do this anymore.
And it's happening at hospitals across the state.
The situation is pretty dire.
Arkansas Department of Health Medical Director of Preparedness, Geraldine Jones, says they are working with state hospitals as well as a federal assistance team to see what they need and request it from other states.
That will provide us with some pointed recommendations in terms of what we can do with the capacity that we have currently.
And as the start of school is on the horizon,
I think things are going to get worse before they get better.
For Sullivan, it's hard to wrap her head around.
We've got a vaccine, we've got masking, we put out all this information, and it's devastating to hear that people don't believe in it and don't trust the science.
She says if things don't get better,
there will become a time when it's kind of like in the middle of battle. You have to triage patients and decide who can I take care of.
At some point, they'll have to turn patients away.
We're looking at that as a very real possibility. That in itself is unimaginable.
Sullivan says 0 of the COVID patients here at UAMS in the ICU have gotten the vaccine. She urges everyone to go get that vaccine to help slow the spread. Reporting live at UAMS, I'm Claire Kreitz. Back to you.
All right, Claire, thank you very much.